Hey Dominic,
Hey Zach, how's it going?
good. Thank you so much for meeting with me this morning. What time is it for you in Germany right now?
At the moment, it's 2 p.m.
2 p.m. All right, so it's 8 a.m. on the West Coast. I think that's a good time for both of us. I wanted to talk to you a little bit today about flat feet, how custom orthotics help with flat feet, and maybe a little bit about the condition itself. But maybe real fast, we can do an introduction for people who may not know us. So I'm Dr. Zach Carton, co-founder of Stride Souls and chief medical officer. And go ahead, Dominic.
My name is Dominik Walter. I'm the head of design at Strike Souls.
And how many insoles have you designed in your life, you think?
Well, that's a very good question. So it's hundreds of thousands. Really design tools for all over
Uh,
the world.
all right, well, then I think you're the person to talk to about flat feet and custom orthotics. So, um, maybe just to kick things off, I can speak a little bit about what flat feet is, and I might need your help. So, I'm a physician, but I am not a podiatrist, so I don't know everything there is to know about flat feet. Um, but flat feet in medical language is called pes planus, and it's a flattening of the arch of the foot. I think it's very well named. The interesting thing is that it can be caused by multiple different things. And by saying flattening of the arch of the foot is a little bit of a misnomer because there's more than one arch in the foot. And I was wondering if you could start adding by explaining the three arches of the foot and how they kind of contribute to the overall structure.
That's interesting that we're talking about that because I got an opinion about this, but let's come to this. So, first, of course, there's the medial arch. So, I brought my visuals. Medial arch is on the inside of the foot. It's this arch that you can see on the inside of the foot. You have the same on the outside. It's a bit less prominent, so you don't see it that much. And there's a discussion about the transversal arch. So um, MTP 5, which is the metatarsal head 5, and between MTP 1, there's a little bit of an arch, like, yeah, transversal. So if you look from the front, it seems like there's an arch. But here, I didn't tell you that before. Uh, Here, I kind of disagree.
Okay.
And there's a reason for it. It is if you have an unloaded situation of the foot, it's the same with the hand. Look, I have a transversal arch here, but only because it flattens doesn't mean that there's nothing to it. If you take a look at the length of the metatarsals, those in the middle are longer than those on the sides, correct? So if you
Yes.
walk, it's natural that at one point, when the first and the second lift off the ground, two, three, four, they're still on the ground. And very often it's misdiagnosed if there's high pressure in the metatarsal area. It's called the splay foot, so the transversal arch would be gone. Um, on a biomechanical standpoint, I disagree. There is no such thing in a loaded situation.
Well, okay, that's super interesting. And I think it gets at the fact that diagnosing and understanding how to treat flat-footedness or pes planus is not as easy as just saying, hey, we need to put in support to the foot. It really requires to have an understanding of the patient's foot structure, how they walk, and I guess how the foot changes under load or under pressure compared to the free bearing image of the foot. Is that fair to say?
Absolutely. Yeah, you got
Very
it.
cool. Um, well, thank you for that information. I know from a medical standpoint, there's lots of different ways that people can become flat-footed, and they're not all the same type of flat-footed. So some people, the ligaments in their feet, just as natural part of aging, side effect of even some medication. People gaining more weight puts more pressure, and that the longitudinal arch can slowly flatten. Another thing that can happen, which isn't maybe technically flat-footedness, but people who overpronate quite a bit put a lot of pressure on the inside. I guess it's not exactly the medial arch, but the inside of the foot. And because that surface is much more planar than the typical bottom of the foot, that can be considered a type of flat-footedness. And then another interesting cause or way people become flat-footed is through pregnancy. When you're pregnant, A lot of the hormones that women's bodies release contributes to flexibility in the ligaments throughout the body for obvious reasons for help with the birthing process. But that can have some negative side effects with the bottom of your feet. And it's one of the reasons why women who are pregnant can experience more foot pain. And then the last one, which is just being born with flat feet, just congenitally flat foot. So, anyway, there's sort of all these different routes to get there, but maybe you can share some of the core tenets or core ways that custom orthotics can help treat flat footedness.
Yeah, sure. First, why is it important to treat it? It's because the medial arch has a cushioning effect on the whole body. So if let's say this is the arch and that's the forefoot, and you have the first impact on the heel, it stretches, the foot stretches a bit about the medial arch. So that's a cushioning effect, and it prevents injuries in the lower back and the upper back all the way to the neck. So it's very important to treat it for the cushioning effect. And insoles are like the best way of, or one of the best ways of treating it, because of course every insole has this medial arch support, like we do at Stride. You can see here, uh, where we position the arch and the highest point exactly where the foot is flat, and we have to consider the exact shape of the foot. That's why the 3D scan is so important here, because to determine how high the arch is, how well it still builds. Like we make the scans in an unloaded situation, right? But that gives us much information about how flexible it is still. So is it still to build the arch? If yes, then we can work in our muscle activating way. If it's not, so in an unloaded situation, it's already flat, the foot, then we need to go in a passive way, meaning to like really passively realign the medial arch.
Totally. And I think related to that, when we watch people do their gait analysis and we can see how their foot changes from the unloaded to the loaded position, we can see how much that collapse happens. That gives us a sense of kind of what the absolute baseline is of the flatness of the foot and gives us a little bit more information about how strongly we need to resupport the arch for the person.
And you perfectly explained why it's so important to have both, like the static unloaded situation as well as the loaded situation, right? Because situation changes.
Yeah, yeah. Well, I think that's what kind of separates us from a lot of the other companies out there that build custom orthotics. We get a really holistic picture of who the patient is, and there's experts such as yourself who've written theses about how to design custom orthotics to change the loading of the foot, doing the actual design. So I think it's really special. I was wondering if we talked about plantar fasciitis last time and helpful types of shoes. Do you have any shoe recommendations for flat-footedness?
Yeah, for flat feet, it's especially important that you have a wide sole, not only from the back, but also, let's take a look.
You're prepared, yeah.
Well, yeah, I have plenty of shoes here. So you see how narrow this is here, right?
Yeah,
This would be a suitable shoe because, when you have the flat foot, it just doesn't give any support. It
right.
So to have a wide area like this
In the
gives you more.
midfoot?
So that's the main thing to take a look on. And
Okay,
due to the lack of natural cushioning of the foot, don't go too hard.
okay, okay. So people with flat feet may not benefit from uh kind of the barefoot type shoes the same way someone with plantar fasciitis or other foot conditions may.
Yeah, exactly. Cushioning is really is something important for a flat foot. Yeah.
Very cool. And then I guess the last question I have for you today, and something that I get asked a lot, is what are the effects of being flat-footed on athletic performance? Does it matter? Can it hurt performance with proper insoles? Can it improve performance? Just really kind of broad.
Well, in general, a flat foot, look, as I said before, it's a cushioning effect, and also it builds up some load, right?
It's
So
like a
like
spring.
a spring, like a spring, if you will. Yeah, exactly. So If you lose that, of course, this biomechanical property is gone. Also, the load is way higher in sports, so cushioning is important. If that's gone, that's really an issue. With the insoles, as I said, in the active way, we build up muscle, we train the muscle. So over time, the goal is that the arch builds up again. But it's also important to know here, if it's a severe flat foot, it won't, only one treatment won't do the trick. So first insole up until here, new scan, new gait analysis, so we can adjust the insole on the new situation. And what you also see very often in flat feet is that they're different from left to right. So don't be surprised if your left insole looks different to your right.
And that's okay. So 2 points that are interesting. One is that with custom orthotics, we can slowly help people rebuild their arch over time. And the first insole, as you said, stimulates the muscles in the foot, stimulates the ligaments, enables kind of precise remodeling of the foot around a proper arch structure, but it may take, the first insole gets you 50% of the way there, and then diminishing returns. The next one, 25%, maybe a third gets you another 12 and a half. But as you keep going, the results are less. But maybe how many would you recommend along that process? 3, 4?
This depends so much on the person itself,
Right.
how trainable everything is, how severe the flat foot is, and that's really a very unique situation for everyone. There's
Okay.
no rule.
Okay. Makes sense. And then I guess part of why I asked about the athletic performance of flat feet ties into my fun fact of the day. So I have to pose this question to you. I know we're running out of time. Do you know how many of the last of everyone who's ever won a gold medal for the 100-meter sprint, men and women, do you know how many of them had flat feet?
In percent,
Yep.
I have an idea, but I want
Yeah.
to talk to you about that later. I think it might be close to, let's say 40.
40%?
A high number, I guess a high number, but I will tell you later why I think that.
Interesting. From what I found, only 5 people have had documented flat feet.
Oh, great. And
Yeah, yeah.
thinking it's higher,
Okay.
because also a way of misinterpret a flat foot. It's if you take a look at very strong feet, they
Okay.
often seem to be flat feet because the muscles in the foot, they're so well built
That's
that
so interesting.
exactly
That's
that
so interesting.
they have more volume. And that's also something key to understand. If you have a very strong foot, it might seem like a flat foot, but if you see it in dynamic, you actually see, okay, that's just muscle.
They're just you just have the most shredded feet of all time, basically.
Yeah, well, yeah.
That is so funny. Well, thank you so much, Dominic. I don't know if do you have any closing thoughts about flat-footedness?
Don't wait too long. If you see in the beginning that it all starts with an arch that sets in the young ages, it's way easier to treat than in older age. So don't wait too
Okay.
long to start. Don't wait for pain, right?
Yeah, don't wait for pain. I know. That's it's so much easier to prevent pain than to treat it, right?
Okay.
Yeah. All right. Well, thank you so much. I really appreciate you taking the time this morning, or I guess this afternoon for you.
Yeah, thank you, Seth.
Yeah. Okay. Bye.